Flu season is here. I'm sure you all want to avoid the seasonal sickness, right? No one wants the flu. In your efforts to avoid the flu, should you avoid the doctor's office? According to a new survey of nearly 2,000 healthcare workers, more than 40% of those who've worked while sick admit that they had the flu as they met with patients. And I'm smiling only because the irony of this scenario. And look, there are reasons for this. Obviously, whether you're a physician, a nurse, if you don't have someone to replace you and there are patients to be seen, there is a mentality of just working your way through it. Now, what I would say is if you did have the flu, I would hope you wear a mask. Yeah. And also, most healthcare professionals should be getting the flu vaccine.
Yeah, in fact, it's sort of mandated to be on staff at most hospitals.
They're not going to let you in. Our little name badges now, it has the sticker whether you've gotten your flu shot.
Yeah. Well, I got my flu shot, but if you can hear me, I worked sick the last 2 days.
It sounds like Barry White. Sounds pretty good.
So basically, you're working sick right now.
Get away from me.
Come here, big boy.
Well, no, the best part is, as we were talking about this segment, Dr. Rodriguez shows up, I high-five him, and we start talking about the segment. He's like, yeah, I'm sick.
Wait, what? Totally sick. I'm better. But you know what it is? If you're a patient and you've made an appointment weeks ago, right, and I'm feeling okay and not horrible, you're not going to like it.
You're probably not contagious.
No, and I did wear a mask, and I wear, it wasn't attractive, but I wore a mask, and you wash your hands all the time. And if you're also for a colonoscopy, and you prep the day before, I'm not going to cancel on you unless really I'm in.
Well, that's the whole thing. That we have a long list of patients that day. We have procedures scheduled. They've changed their schedules. It's tough to cancel out on them.
Plus, I think apparently most physicians, so 63% of physicians have worked sick at some point, and it's because we don't want to let our patients down, we don't want to let our colleagues down if we're in a more hospital-based setting. And like you said, many of us sort of say, well, I feel well enough, I'm just going to power through and I'm going to do it.
Dying.
But one study actually showed that you're actually 5 times more likely to get sick if you do happen to see a sick healthcare provider.
If you go to the hospital or you go to the doctor's office, the reality is these are areas where sick people congregate.
Exactly.
Yeah.
And the reality also is that healthcare workers also do get sick. And so I think it's just being cognizant of that, being conscious of it. When you are in a healthcare facility, you should be very careful with where you're touching things, and do not touch your face, your eyes, your nose.
Wash your hands.
Wash your hands.
All the time.
I guess we just don't leave the house, right?
No, we don't
float in your pool and you'll never get sick.
Pool? But I think, you know what? I think there's a great point that culturally, I think doctors are taught during our training to just sort of
power
suck it up.
Such a great point.
Right?
In our training, we never want to call in sick because we're screwing our co-residents or interns.
But I mean, we need to learn. My point is to take care of ourselves also.
I'm telling you, the culture will not change because the reality of training in particular, although I know it's changed a lot since we all trained and it has become much more benign. But I'm telling you right now, when I trained, there was no, hey, I'm feeling a little under the weather, I'm not going to be in this morning.
Exactly.
That wasn't going to happen.
And if you did do that, everybody was so mad at you because you had ruined their plans.
Right.
You had jeopardized them.
I caught mono as an intern, and they said, why don't you take 2 days off? Come back on Monday. Seriously.
You know that last week.
Who are you kissing?
Horrible sore throat.
Who are you kissing, Jorge?
Who wasn't I kissing?
The U strikes again.
Oh, you got me. All right,
And he was the class president at the U. I guess part of his job was kissing.
That's how I got the votes.